Okay? Now this one is also the old pec push. Okay? So you're going to push against that, you're going to feel it in your biceps, you're going to feel it in your chest a little bit, and what it's doing is bringing blood flow, creating tone in those areas, because that's important too. That's part of your cervical chain. The rhomboids, which we just did, alright, that'll help keep this kind of posture, but this actually tones the cervical chain, which is very important as well. And then the next one you see on your sheet is the twist, which I want you to be very careful with. You ever seen the people that do this, especially like golfers and stuff, and guys, okay? It's a really great way to ruin a disc. It's a great way to rip fibers, okay? So I teach all my patients that when they're doing this one, they cross their fingers like this, and they'll put their thumbs on their cheekbones. This way, when they very slowly and gently do that little twist, their body is not going in a million different directions. It's all moving as one unit. You guys get that? You can do that at your seat, or you can actually turn and grab the seat and just breathe it out. Now the reason why I want you to be careful with this, if you're sitting and you reach back and you have that urge and you do a little of that pull to pop your pelvis, does anyone do that here? Okay. This is not a good thing, because the pelvis isn't sitting properly. Any joint that you take to that point and pop it means it's not sitting properly, and what you're doing is you're taking it past the point it's trying to stop. Okay? So a lot of people say, well, wait a second, Doc, you're a chiropractor. Aren't you doing that to everybody? There's a difference, totally. Like cracking your knuckles, okay? Let's use this analogy, right? Because I'm sure you have kids and people in your family crack their knuckles. Bad news, right? Here's why. A knuckle, when it goes out of joint, it always drops. That's how it goes out of joint. Well, what do people do when they crack their knuckles? They push it, or they do this. They're pushing it further into destruction. So I have a knuckle that, actually I heard it was, trust me, that every once in a while needs to be set. So I'll just pull and lift slightly, and it'll pop, okay? When you guys are doing this kind of stuff, you're popping that in the wrong direction, creating arthritis and degeneration. When I do an analysis on you, I look to see which way it's already out, and then begin to place it in the right direction so the body can go back into synergy. Okay, that's the first one. Okay, so some more lower back exercises. These are more lower back and legs. I'll do it standing. Should be sitting. But so basically, you're going to sit in a chair, grab the chair. Right? If you want, you can push your chairs back and actually do this. Grab the chair to stabilize yourself. Good posture when you do it. Okay, everything's about good posture and breathing. Okay, and then what you'll do is you just lift the leg up, right, and feel that stretch. And you can even pull that toe in if you want. Okay, and once you do that, then you'll do the other side. Lift, pull that toe in. Ooh, this leg needs to stretch. Okay, but see, that's what happens. I'm a guy who stretches every day. Today, you know, we had a busy day yesterday. We were up late, and my energy's a little on the low side. But because of that, one of my weak areas is a little tighter. So I would be somebody, if I were you, who'd be stretching 3 or 4 or 5 times that day in those areas. Okay? Constant oxygen, constant blood. And every time you stretch, increases the lymphatic system, which is that system in your body that pulls toxins out of tissues. We could use to be a little less toxic, what do you say?